Hello, my name is Davis Woodworth, and I am a postdoctoral scholar in the Department of Neurology at the University of California, Irvine. Thank you for your interest in this very timely conference on limbic predominant, age-related TDP-43 encephalopathy. The authors have nothing to disclose. LATE is a new and important pathological entity involving TDP-43, and it's thought to primarily affect the oldest old or those over 85 years of age. However, how strongly and the mechanism by which TDP-43 affects dementia severity across the age spectrum is an important and open question. Our objectives were to examine the strength of association of TDP-43 with dementia severity in oldest old versus younger old participants. We also did this for Alzheimer's disease neuropathological change for comparison. And we also wanted to test whether hippocampal atrophy mediated the association between TDP-43 and dementia severity in oldest old versus younger old participants. Again, we also looked at Alzheimer's disease neuropathological change for comparison. We used participants from the National Alzheimer's Coordinating Center database, participants that had pathology data, and we limited to those that have our pathologies of interest or had information on our pathologies of interest. So information on TDP-43 in the hippocampus, Alzheimer's disease neuropathological change score or ADNC, and gross hippocampal atrophy or an assessment of hippocampal atrophy on the gross tissue at autopsy. We limited to participants who had a clinical visit within a year of death and importantly excluded pathologies related to frontotemporal dementia, such as FTD tau, FTD TDP-43, amyotrophic lateral sclerosis, and other FTD, or if they didn't have information on these. We have final participants of 506, and 216 of these were oldest old, 290 were younger old. They both had a somewhat similar equivalent of TDP-43 in the hippocampus at around 20%. The younger old did present with dementia more often, had slightly worse dementia severity, and the proportion of ADNC high likelihood was a bit higher in the younger old participants. We used clinical dementia rating. Some of the boxes as our outcome measure. We used TDP-43 dichotomized by presence or absence in the hippocampus, and Alzheimer's disease neuropathological change, high likelihood, dichotomized at high likelihood. Adjusted for age at death, sex, education, interval from last visit to death, and the other respective pathology. We did separate analyses in the oldest old and in the younger old groups. For our strength of association with dementia severity, we did linear regressions with relative importance analysis and report the variance in CDR, some of the boxes explained by each pathology. For mediation analysis, we looked at hippocampal atrophy as mediator and report the proportion mediated by each pathology, or the proportion mediated by hippocampal atrophy for each pathology on CDR, some of the boxes. For our strength of association, we see that in the younger old, TDP-43 explained a low proportion of the variance in CDR, some of the boxes, but in the oldest old, this was a bit higher at around 5%. These are both lower than the variance in CDR, some of the boxes explained by Alzheimer's disease neuropathological change, which is around 25% for both groups. And for our mediation analysis, we see that the effect of TDP-43 on CDR, some of the boxes, was not mediated by hippocampal atrophy in the oldest old, but was in the younger old at a proportion mediated of around 40%. Meanwhile, in Alzheimer's disease neuropathological change, the proportion mediated by hippocampal atrophy was about the same in both groups at around 25%. So to conclude, TDP-43 appears to be more strongly related to dementia severity in the oldest old compared to younger old. The effect of TDP-43 on dementia severity was not mediated by gross hippocampal atrophy in oldest old, but was in younger old. In contrast, Alzheimer's disease neuropathological change showed similar strength of association with dementia severity and similar mediation by hippocampal atrophy in both oldest old and younger old alike. This suggests that while LATE is an important contributor to dementia severity in the oldest old, the mechanism by which this occurs may be different in the oldest old compared to younger old. I just want to quickly thank NAC participants and ADRCs. Want to thank Dr. Sajati, Dr. Kurata, Dr. Kawas, Kiana, Hannah, Janice, UCI Mind and ADRC in the 90+ study. Grant support from my primary mentors, R1. Also, I'm fortunate enough to be on a T32 headed by Drs. Grill and Liz Head. Here's my contact information. If any of you would like to chat about any of this with me, I'd be more than happy to. Thank you for listening.